Hi everybody, my name is Sydney and I'm going to be doing discussion number 2 on equity disparities in COVID within Brazil. So first, I want to share a breakdown of COVID in Brazil. Brazil is the 9th most unequal country in the world. When COVID arrived in Brazil in February, they did not follow guidelines. By May 13th, 2020, they had 177,589 cases with 12,400 deaths. So by May 20th, 2020, 1 week later, they had 60,000 more cases. So this led to Brazil being that leader in the highest transmission rate in the world. And some people may ask, well, how come? And it is a result of their leadership. Brazil's president has led the country into a denialist approach. So President Jair Bolsonaro made public announcements to dismiss quarantine and safe practices, including hand washing and social distancing, despite CDC's recommendations. He was quoted saying, "So what? What do you want me to do?" This leads me to believe that Brazil's economy is of its main concern and not its people. When we look at access to sufficient health care, we can see that the public universal health system is a system they have in place called the Sistema Único de Saúde. But this system is historically underfunded and is going to be representing the source of medical care for 75% of the population. When we look at the distribution of ICU beds between private and public sectors, there's quite a disparity. So the SUS has 1.3 ICU beds per 10,000 people, and the private sector offers 4.45 per 10,000 people. It's been shown that patients hospitalized in public hospitals had a higher risk of mortality than those in private hospitals, and this is the same for COVID, or COVID mortality. So 24.2% of the population has private insurance, leading the rest of the country to go about public universal health care. And something that I wanted to point out is that the 75% of this population that is using public universal health system, 80% of that population is Black. As for regional differences, we can see that the north and the northeast region of Brazil is significantly poorer than the southeast region. And this also contributes to healthcare as well. So the southeast region has 2.58 ICU beds per 10,000 inhabitants versus the north and the northeast region, which has 1.3 and 1.35 ICU beds per 10,000 inhabitants. And if we look at the right graph here, it's showing the Human Development Index from 1991 to 2010, we can see that the average Human Development Index in the northern region is significantly lower than the southeast region, as well as the national average. So odds of mortality due to COVID are much higher in this population. As for socioeconomic differences and disparities, there are 30 million Brazilians that do not have access to basic sanitation. So in regards to COVID, this is completely sort of hand washing is out the window, sanitation is out the window. 11.4 million people live in slums. So the overcrowding that's going to be a result of this is going to not allow people to follow those guidelines of social distancing. Economically disadvantaged people have a higher prevalence of chronic disease. And if we go into that, comorbidities are also a leading reason for higher mortality rate due to COVID. Risk of contracting COVID is much greater among the lower class than the upper class. And I also wanted to point out that Brazil has the third most prisoners in the world, 773,000, and initiatives to protect these prisoners are almost none, which has led to protests in the prisons there. As for educational disparities, public education is free at all levels, but the quality is low. So if we go back to last week's Sustainable Development Goals, number 4, quality education is a goal, but It's important to emphasize here that the public education is free, but it doesn't mean that it's going to be very high in terms of quality. And this is dependent on socioeconomic status and region. So the wealthier you are, and if you live in the Southeast region, you're going to have access to higher quality public education than the public education if you were within the North or Northeastern region with a lower socioeconomic status. Resulting careers are unequitable because people do not have the education or resources, and 7% of the population 15 years and older was reported illiterate. I thought that was an important thing to mention. As for racial inequalities, the majority of poor people in Brazil are Black, and the higher case fatality rate by COVID-19 was among Black citizens. 23.1% of Black Brazilians were hospitalized due to COVID, where 32% of that population died. So these people are going to be living in the North and Northeast region with lower socioeconomic status. Also, Indigenous people are more vulnerable to COVID due to their worse socioeconomic status and health conditions. Also, there's barriers to accessing health services due to proximity and also that worse quality of care. Finally, I wanted to mention I looked into a study called Physiological and Socioeconomic Characteristics Predict COVID-19 Mortality Resource Utilization in Brazil. Can you see that? Sorry. The purpose was to examine predictive socioeconomic factors of COVID mortality and medical resource usage to help inform health policies. So they started with over 113,000 patients and 50,000 patients that were deceased. So they found that for predicting mortality, geographic location of the hospital, education level, hospital type, and race were key variables in classifying the outcome of the patients. Comorbidities were also highly predictive. Assessing the socioeconomic factors in mortality and resource utilization in a low middle income country found low patient level of education to be significantly associated with mortality. Going back to that 7% of Brazil's population 15 and older self-reported illiterate. So just finally, sort of who is most impacted. Because of this low patient level of education, the lower socioeconomic status, the geographic location of the hospital, as in the North and the Northeast region, the hospital type, public versus private, the public is going to be worse quality of care. And also we saw that the majority of the lower socioeconomic status was the Black community in Brazil. And finally, I have my works cited. So thank you guys all for listening, and I hope you have a great rest of your day.